Hello, my name's Claire. I'm one of the nurse specialists and a clinical nurse endoscopist here in the endoscopy department at Derriford Hospital. Esophageal manometry is used to check whether the muscles in the esophagus are working properly. When the muscles don't work as they should, you may experience symptoms such as heartburn, trouble or pain when swallowing, chest pain and regurgitation, which is where food comes back up after swallowing. pH monitoring is one of the gold standards of diagnosis of a gastroesophageal reflux disease, and you may obviously have a long-standing history of reflux to be referred for this. Your appointment letter will ask you to come to the endoscopy department, level 7, zone D, Derriford Hospital. You will report to reception and our reception team will contact one of the clinical nurse endoscopists to come down and carry out your procedure and meet you. We will take you across to Norfolk ward, which is across the corridor where we are currently doing these procedures. You may be referred for esophageal manometry only or pH monitoring only. Sometimes you are referred for both. If you are having the pH monitoring, you will require to return again the next day as a second appointment to return the equipment that you will go home with. We will take you over to Norfolk, sit you down and show you the equipment that we're going to be using. So the first procedure would be the esophageal manometry. That's using a catheter about the diameter of what we call a phone charger size. It's orange with silver sensors going down the length of the catheter. This is placed using a technique where we both have to work together in order to get it down correctly. It is an invasive procedure, but everything is done nice and calmly. You will spray your nose with some local anaesthetic, so dependent on which side of the nose, if you have any issues with that, we can go to whatever side that you'd prefer, but we spray that nostril with some local anaesthetic to make it nice and comfortable for you. It is not a painful procedure. So the first thing that we will get you to do is to look up at the ceiling, and at that point we will place the catheter up and over the back of the nose. This is done very gently. When you can feel it at the back of the throat, you would be able to let us know. At this point, to stop any retching or gagging, we will pull back the catheter 1 to 2 centimetres to avoid this. We will then place your head so it looks forward, and then we will pass you a cup of water with a straw which we will guide up to your mouth. At that point, when the straw is in your mouth, we will get you to look down at your toes, and so your neck is slightly in the bent position. We will then ask you to take quick sips of water and swallows in quick successions, and as you are doing this, the catheter is being pushed down slowly through your esophagus and then down into your stomach. At that point, when it is down, we will then take the water off you and ask you to look again in the forward position. We will then pull back the catheter so that it is at the right depth for you, because everybody's length of esophagus is different. When everything is correct and in the right position and matches up with the monitor that we will be looking at to conduct your procedure, we will then tape the catheter in place to avoid it moving and irritating. We will then continue with the test that we need to carry out. The first part of the test, and it is a very quiet test, we do ask that it's nice and calm, is for you to sit nice and still, no moving, no talking, and we ask you not to swallow for 1 minute. This can sometimes feel a long time, and you can practice this at home if you feel like you need to. So once you are not swallowing for 1 minute, it is testing a resting pressure. After this, we will get you to swallow before we proceed on to doing 10 swallows. So this will be 10 swallows of 5 ml of water at a time, so not very much, and we would ask that you swallow only once per bit of water. There is only approximately 27 to 30 seconds in between each one. After the 10 swallows are completed, we then proceed on to another resting pressure of 1 minute. This is doing the same as we did right at the beginning. After this is completed, we will then pass you a cup of water, and we will ask that you drink the whole cup of water and continue to swallow afterwards as you need to. There is just no talking or moving, but continue to swallow. Once this is completed, we will end the procedure and we will then look to remove the catheter. This is done very gently and slowly. We untape the catheter from your nose, we ask you to take a breath in and then breathe out slowly, and as you are breathing out, we will then just remove the catheter. We then give you a couple of minutes breather before we then proceed on to the pH monitoring test. This catheter is slimmer and is about the diameter of a cooked bit of spaghetti. How we get that down is exactly the same way and the same technique as the first one went down. It is then, once in position, it has a sensor on the end and about 15 centimetres up, and this is looking at what acid is refluxing up into your esophagus during a 24-hour period whilst you are eating a bland diet. You will have a list of foods to avoid, and you will have an example of a menu of foods that you should consider during the next 24 hours. Any PPIs, this is a proton pump inhibitor medication, and any other medications mentioned on your letter will need to be stopped during this time and prior to the procedures as explained in your appointment letter. Once this catheter is placed, it is then attached to a monitor which you will wear for the next 24 hours. This monitor has 4 buttons on there. It has a symptom button, medication button, when you're eating and when you're going to lie down. We ask that you lie down for 8 hours even if you are not sleeping, and lay as flat as possible, but obviously still comfortable for yourself. Any medications and when you're eating needs to be recorded on the diary that will be provided and will be explained to you on the day. Each button that you press for symptoms, they need to be recorded also on the diary, which again will be explained at the time of the procedure. Once this is completed and the catheter is in place and it's attached to your nose, we will also anchor this catheter to make it a bit more comfortable, so it will go up and over your ear on the same side as the nostril that we use, which will be taped to the side of your face also over the ear and then taped to anchor it on your neck. This is to avoid any accidental pulling out of the tube. The next appointment will then be given to you to return the next day. When you return, you go to level 7 endoscopy unit and report there, where again one of our admin team will contact us and we will come down to see you. The removal of the catheter will take seconds, and you should only be on the department for about 10 to 15 minutes. We will then ask you to leave, and your results will go back to our consultant who reads both of these results from both of these procedures, and the results will finally go back to your referring consultant, who will then write to you with the results of this in due course.